Hi, everyone who's joining us today for this webinar all about navigating local health for global teams. So I'm just going to wait a few minutes for everyone to enter into the webinar.
Oh, and while we're waiting, if people can tell us where you are in the world, that would be really cool, because that's always my first question to everybody. It's amazing to me to find out, because some people have some really exotic locations.
Definitely.
Where are you in the world, Leah?
Well, I'm based near Liverpool in England. What about yourself, Masha?
I am currently in Abu Dhabi. I don't know if I can say I'm based in Abu Dhabi. I'm based in a couple of places, but we'll go into it in the introduction.
Well, all to be revealed.
Ooh, Trinidad and Tobago. I have not been. That's definitely on my list.
Wow.
What should I see? What should we see in Trinidad and Tobago? This is like a resort type of destination, isn't it? I'm totally going to Google it. Yeah, okay. It's gorgeous.
Wow, I bet. Right then, I guess we'll start getting into it, and as people can filter in, they can get involved in the chat there. So, hi everyone. As I said, welcome to this month's Remote First webinar. We're going to be discussing the importance of health insurance for global teams. Joining me is Masha, our Global Director of Business Operations and People. So we're very lucky to have her today. Masha, I know, as you just said, you currently live in and have lived in multiple countries. So if you want to just give us a little introduction and why global health is such a big deal in today's world. Thank you.
Yeah. I mean, I think I'm a good example of why it actually matters, right? So I am originally from a very unpopular place right now. I'm originally from Russia, but I'm also American. So I moved to California when I was 16. And so being global was really important even then for me. I ended up working in Silicon Valley, moving with a company to London, then to Paris, then back to London, then to Dublin, then to Abu Dhabi, then to Portugal, then back to Abu Dhabi. And now I'm in between Abu Dhabi and Portugal, hoping to go back to Portugal soon. And so I not only have I set up benefits for multiple startups, I was also a vendor. I was also a user of those benefits. I've both had global and local insurances, and they do make a difference for essentially how you live, right? And how you experience well-being. And so we can talk a lot about the nuances of all, but I think we probably should kind of highlight what are some of the choices out there first. What do you think?
Yeah, I think let's get into it. I guess it would be perfect opportunity to start with a poll to see what actually people know about local and global benefits. So I'm just going to pop this poll on here, and it's just asking, how familiar are you with the difference between global and local health insurance? If you
All right.
that.
Very cool. Okay, so we have different ones, different levels of understanding. So let me go in a little bit and kind of think about this from a more global umbrella perspective. You essentially have multiple options. You have the global health insurance umbrella. What does that mean? It means that it is global coverage that actually covers multiple countries. And the way most insurers set it up is they'll cover all countries except for US and Canada. Or if you want US and Canada, then your premiums are skyrocketed. Probably most people know US health insurance or US in general health space is extremely expensive. Lots of people unfortunately go bankrupt when they have serious conditions, even if they have health insurance. There's been a lot of discussions around this in the US, but Canada is also one of those countries that unfortunately the prices are going up for that space. And so depending on where your people are, you would potentially choose not to include US and Canada. The other option is to have a local health insurance. And this is very much just for the country where you are hiring your employee. It's much more tailored and it's much more in depth usually than the global health insurance plans. And why is that? Global health insurance has to kind of standardize across multiple jurisdictions. That's kind of hard to do. There's so many nuances locally. And so, yes, you have generally pretty good level of preventative care, but it is standardized across, so some of the nuances get lost. Whereas local health insurance is much more boutique, it's much more tailored to the local customs, the local expectations of the market, and also local compliance requirements. You'll actually have some global plans that they seem like a good choice, but they're just not quite right for the local compliance requirements. And to navigate this for a global employer is quite difficult. Last but not least, you have a different contingency of workers who probably just go on short-term trips and they don't need that preventative care. Then you will be looking at actually the business insurance. And it is exactly what it describes. You go on a trip for some meetings on business and say something urgent happens. You unfortunately slip on a banana and, really hurt your bum. You will be seen, you'll be taken care of. But if you want to go and, take care of your root canal that you've had for the last 3 years, that's probably not going to be a thing.
Definitely, yeah. I think you've covered exactly what the different options are, but also why you might choose one over the other. I think it's important to know that the global health insurance is a great option when you're across different countries, but you need to know that each country has different requirements, unique needs, and this local insurance that is more tailored and comprehensive to that exact country, I think is also important to know. And it's now evolving in that way that you need to realize that, people have their own needs. And this business travel, that it's only for short term, it's not going to work for a long lasting insurance. I think that's really important. But then I guess those are great definitions, but let's talk about the why. So
let me give you an example. It's always good to use an example, and I'll use myself as an example. I have global health insurance. I personally have it with Cigna. It's one of the many providers on the market, but I made sure to exclude US and Canada because my premiums would have been 3x what they actually are. But I get coverage in all of Europe. I get coverage in the Middle East, but it got a little tricky with the UAE. I couldn't use it in Abu Dhabi. I could use it in Dubai, but I couldn't use it in Abu Dhabi if I wanted to be on a work visa here. So there is a local requirement. Well, in general, in the UAE, it's very interesting because there is a requirement that you have private health insurance for your visa. And if you think about like this particular area, 83% of the population are expats. So they all have visas. So they all are required to have this local health insurance. Dubai is a little bit more forgiving. They will take something like global coverage, but Abu Dhabi, which is the capital of the United Arab Emirates, they're a little bit more conservative. And so they focus on specifically promoting local vendors and local health insurance providers. So you can't use a global healthcare plan. So for Abu Dhabi specifically, I had to get just local health insurance so that I could tie it to my visa. And so this happens a lot in different parts of the world. You have to really ask yourself, what are you trying to accomplish? What is your motivation? So are you trying, as a company, are you trying to retain employees? Are you trying to attract your talent that's specifically in certain region? Or are you trying to have a very equitable culture across your different jurisdictions, right? Because you will have a different approach based on those needs. Are you a small startup? Are you like 10,000 people? You're also going to have a very different set of benefits. But you also have to think about, is there like local free health insurance? And what's this market standard? Are you meant to top up?
Yeah.
Are you okay with just regular health insurance? What's a good level?
Yeah. What are your competitors doing? Do you have some competition? Are they stealing all of your talent because your health benefits aren't good enough for the people that you need? I think this goes perfectly.
Are all your people created equal, right? Like, are you trying to get engineers that are really hard to get? You're probably going to do a very different level of coverage for them. Or are you trying to get maybe somebody at a different skill level that's a little bit easier to get? And so you might differentiate based on how difficult it is to get that talent as well.
Absolutely. I think that's really important to think about. And I guess it's important to ask you out there. So while you're thinking about this, what is everybody's biggest motivation in your health benefit strategy? I think it's important to think about that starting business goal before you just jump out and reach a health benefit that is not actually something that you need. I think it's really important to think of that baseline business goals before reaching out and spending a lot of money on something that might actually not be the best fit for your employee or your team and the country it's in. I think it's really important. Yeah, compliance and risk mitigation is definitely
an important one, right? Really quick, while people are voting, if you hear snoring, by the way, it's not me. I have 2 French bulldogs, and both of them are snoring really loudly behind me. And so it occurred to me that this may be quite distracting for the audience. So apologies. They are very nice, but very, very loud. All right. So what do we have? Compliance. What other?
And attracting top international talent as well.
Yeah. And so that one is a really interesting one, right? Because different regions are going to have very different set of expectations. For example, Middle East for a very long time has been considered kind of a hardship region. What does that mean? That means that you have to really attract talent to come here. I think it's now shifting. Dubai seems to be very cool. They have a nomad visa, it's quite trendy. All the influencers are doing it. So that is shifting. But back in the day, for example, it was very difficult to get people to commit to going to the UAE, mostly because of the weather. Honestly, it gets quite hot right now. I think it's about 40 degrees outside, and that's not even summer. So in order to attract people, and especially top talent folks here, you have to combine this. And so there's a certain like standards. For example, employers used to pay for housing. Housing is meant to be paid a year in advance. Employers pay for the visa for the person as well as their family. That's pretty standard. Employers pay for health insurance, and normally they pay for you and your family. In some other regions, that feels like quite luxurious, right? Maybe they'll cover you, but they won't cover your 6 kids. But here, totally normal. They will even pay for your kids' schooling. Again, everything here is yearly, it's not monthly. So to come up with that amount, it's quite a burden on the employee, if it is on the employee. And so you actually want to consider, hey, can they come up with such an amount upfront? And it's required to do that. And so you really have to adjust to the local conditions. The other, for example, example is Europe. Europe has quite by comparison to other countries like the US, quite a strong local health insurance, right? Yes, you're going to wait, but for like very significant issues, normally you can get care and You're not going to go bankrupt over it. However, if you are trying to attract top tier talent, there's an expectation that you're going to top it off. You're going to top up the insurance so that they don't have to wait. And so the real benefit of the private plans is the speed of service that you're getting. And it also means that you're going to newer hospitals usually. While in the UAE, for example, you'll get a private room. And if you're sick, you will get a 3-course meal. Like it's quite luxurious, and it's perceived as quite luxurious, but totally normal in this region. And so as a company, you need to ask yourself, well, do you want everybody to have the same experience? And how do you then tailor it to local regional expectations? Because we had this issue in one of our startups where the entire US, which was the majority of our folks, we had some in Europe as well, they were all very, very upset that the UAE was getting such great benefits. They were like, it's not fair, you're treating them better than us, but you just can't compare because they also had to work in 50-degree weather. And so you have to kind of adjust for the conditions of the country.
Yeah, I think even things like temperature of the location, I think, is something that you actually wouldn't consider. And I think on the culture, like you said, in Abu Dhabi, they're very with the private rooms and the 3-course, that's embedded into their culture. So for someone there, that actually might seem quite normal, but for someone looking in on that, that seems like the craziest healthcare system ever. But for them, that's what their culture is. I think it's important to understand that locally people's cultures change, and that's actually why they like that. But also, as you say, UAE compared to the UK or Spain, the healthcare varies so much because we have add-ons, or you have the NHS for the UK, for example.
I mean, I gotta be honest, I've previously flown to the UAE just so I can get treatment, because I would have had to wait, even with private health insurance, I would have had to wait for 4 months in Portugal. And I was just like, oh, no. But it also is totally normal for people who tend to live in that country, right? Or take the Philippines. I have quite a serious case with a friend of mine who has both public and private health insurance. And unfortunately, she ended up in an ICU with a brain swelling. It happened really suddenly. None of the insurances really covered much. And to even get reimbursement, you have to really fight to get it. The system is very difficult to navigate. And so if you're doing this on your own, that's hard. If you are doing this in a larger pool, that's much easier. And what do I mean by that, right? Clearly, you're here because you probably are interested in the EOR model and potentially hiring people around the world through the EOR. One of the benefits of the EOR model is that even if you are a very tiny startup, you can get access to a healthcare plan with a large pool of people. That means better premiums. That means much higher coverage. That means things like pre-existing conditions do not really impact it as much. Because if you are trying to set it up yourselves in that country and say you have under 5 or 10 employees, they'll force you to do medical underwriting, which 1, takes forever. 2, it increases the things that are just going to be unavailable to you in your coverage plan until you reach a certain number of people. And so going through an employer of record service, you get access to that large amount of people, and you can get better coverage, you can get better rates. And that matters for a smaller startup. So that's not something you could do yourself easily. And then over time, it changes, your needs change. If you end up, growing to the point where you want to open your own entity in that country and transition to your own entity, you would have to set up your benefit plans. And so this is when you really need to start thinking about, okay, do I have enough people? when does it actually make sense to transition? Because it's quite difficult to determine when it's worth it. And so we'll have that conversation as well. We can have a conversation about how we can help you when you do transition. And so there's lots of nuances here on how do you tailor it for your culture? How do you tailor it for the type of talent that you are hiring? What country you're trying to build presence in? What's expected in that country? The levels of like the layers here just keep adding, and just the administration of this is very admin heavy. I don't think most smaller startups have the bandwidth or the know-how to know where to push back, to know how to negotiate, to know when really this isn't enough coverage for the market or for that level of employee.
Absolutely. I think, as you said, there's a lot to consider. As you said, it's exactly where we can step in, but I think it's all about the overall business goal of where you want to be heading, but also looking at that employee well-being and what you want to get out of it is really important. At the end of the day, if your employees' well-being is great, they have the best benefits, they're enjoying their job, then they're going to stay with you for a longer period of time, and you've got that retention and you're keeping your employees, then people want to work there, so you're growing more. For a startup, that's the recipe for a perfect company. They're scaling at speed because people want to join, people are staying there, the company's getting bigger, the software's getting better because the team's getting bigger. It's just
I agree, but with a caveat that you have to reassess and you have to balance it, right? I would love to offer all the benefits, for example, that I used to have back in the day when VCs gave away money like, it's candy. I used to have laundry service. I used to have catering. I used to have a massage therapist on site and a chiropractor. And I had a housing subsidy. So all of that was lovely, but the economy changes, the conditions change. And so what is that balance, and how do you find out how to balance what really you can sustainably offer with what you really need in order to be competitive at your stage and on that market?
definitely trying to be competitive, but also not sort of going too far that it's going to change that fast and you're going to have to reassess it too quickly. I think it's important to, I should say, keep moving, but also keep sort of evaluating and measuring what has happened. I think
measure the efficacy of your benefit plans.
Yeah.
What is it actually doing? Is it keeping your employees? There's a way to measure this. The other thing is, if you are doing benefits administration yourself with your own entity, one of the limitations is that you're really kind of bought into whatever you've set up, right? And so the rate of change is going to be slower. And so your reassessment may take time to implement. One of the examples I like to share is that back in the day, in one of the startups that I worked in order to attract people in the UK when they were first starting out there, they decided to offer 10% a pension contribution and then 5% from the employee. Anybody who's worked in the UK knows it's outrageous. It's absolutely outrageous.
Yeah.
And so then they got to a point of having almost 1,000 employees in the UK, and that was completely unsustainable for the company. So how do you then gradually kind of change without people feeling like, wow, you took something away from me because now I'm expecting this, right? And so one of the benefits of the employer of record is that we have so many options. We not only have standardized plans for different countries. And so normally how we approach it, we'll give you several tiers to tailor it to your needs, right? Which one do you want to go with? Or maybe it's different depending on your population. Is it an entry-level employee or is it a senior executive? And you probably will want to do something different for the different groups. But then you can also do something even more custom, right? If you really want to. And when you reassess, you can quickly change because all these benefit plans have already been established. They have very large groups of people. And so the flexibility of change is it is just unprecedented, right? And so that's one of the benefits. Plus, you just don't have to deal with the administration. And that's a big deal. I don't know how many people have ever done a census of their company and then have to sit there and like manually one by one make sure that all your data is correct and then go through all the pre-existing conditions and then negotiate the rates with the providers. But it is quite stressful and it takes forever. I think at some point, and I was working in California at the time, I had to fly out to another country for 3 days just so I can close it, one of the health benefits plans, because we couldn't get to a resolution on email or on phone or on text. And so I had to show up.
Yeah, exactly. It can be very complicated, and you have to think in those different countries, there's different laws and regulations that are needed for that specific country. And if you don't know that, there's so much more than just opening up in Spain. I'm going to open up, like, it's a lot more than that, and people have to realize.
And you have an added layer, right? So there's a difference between, for example, local employees and expat employees. In many, many countries, expat employees or non-nationals who need some kind of work authorization in that country will have additional requirements for what you have to provide in terms of benefits, because they don't have access to the same pool of services, and they shouldn't. It makes sense, but the employer essentially is going to have to pay a premium on being able to sponsor a non-national employee. But that can be a really strategic move because potentially you're just expanding into a new location. And when you do, you want to build the same culture that you've cultivated in your headquarters. That's very hard to do unless you send some of your key cultural employees to build that culture, right? Potentially you do it remotely. We do it remotely all the time, but it's really nice to be able to at least once in a while do it in person. And so I'm a big proponent of remote work, but I also believe in hybrid work. I also think that some companies just work better in person. And so for that different setting, you are going to need different benefits. You're going to need different assignments. You have to really think about what your goals are and what outcome you're after. And that tailoring, that boutique type of approach, that's really where EORs shine, because they have an ability to provide more options than if you were to go ahead and do this on your own as a small startup in a new country. When you're trying to navigate complexity of compliance, I don't know if anyone in the audience have ever set up an entity before in a new country, but I've had many sleepless nights. And once you set up the entity, you think, oh, great, we're done, right? No, you have to then maintain it. And sometimes you have to hire a certain number of employees to make this actually work, because you can't set up your benefits unless you have 5 to 10. You can't offer anything at all. And how do you then remain competitive if that's the case? And so, especially as you kind of explore the different markets, as you explore expansion, do so in a low barrier of entry way. And so using an EOR is a really good way to kind of test out and understand, is this the market we really want to invest in long term and establish roots in? But in the meantime, how do we actually support the talent we want and attract the talent we want?
Yeah, absolutely. I think you've discussed everything about why it's important and the different reasons why you do it, how you can do it, what the different options are. But I think all comes down to that, the cost. I think the cost and the coverage, because how many costs?
I don't know if that's true, right? So again, I like a good deal like anybody else, but I think that there is kind of again a balance. The balance is cost versus value, and you
Yeah,
have to kind of look at both. I know lots of startups that aren't as interested in cost. They actually want like top notch, premium insurance set up for their employees. That's how their culture was built, and that's something they want to do, and we help them do that. There are other startups that are much more, in an existential, like we're still trying to survive stage, but we still want to try to do the best that we can. They're going to be much more price conscious and then reassess over time. But again, I think with both, you really have to measure your efficacy. You have to measure whether or not this is helping you as a company, this is helping your employees. And there's lots of ways to do that. Whether it's usage, whether it's feedback that you collect. We collect lots of feedback. We ask people to help us understand what works, what doesn't, especially if something doesn't go right. Really digging in and understanding, was the expectation not set correctly? Did we not understand the needs of the client? And then we need to learn from it, and we need to also reassess and also rethink the overall strategy. And so we continuously work in every country, not just on local compliance, but also understanding our clients' needs and figuring out how to learn to adjust to their needs over time. I
yeah.
think that's very important.
And I think, yeah, that the value of it, I think goes down to the prioritization, and when you're getting that feedback, what is the highest priority? What was maybe mentioned the most? What have you seen come out of that feedback? And then prioritizing that. You don't have to sort of go full and do every single thing that everyone suggested that is required. You have to prioritize that to go back to your original needs of why you've done this and what you're maybe wanting to get out of the first quarter or this year. So you need to think about by prioritizing these different things, how is that going to tailor and make maybe the well-being of that person better, the company better, and starting small as well, as you said. Like, you don't have to go all at once, but obviously if you use EOR, you've got local partners that know all of that knowledge. But if you start small and take it sort of one step at a time and finding out that feedback, what people want, you can start to sort of tailor it to exactly what your culture's values and your company's values are, and making sure that employer branding is spread from your original HQ to your Spanish entity, your UAE entity, because at the end of the day, it's the same company. So yeah, you need to make sure those values are set across, but you're prioritizing what's right and making sure you're keeping on assessing that, definitely.
And I think that's hard to do, right? It's also hard to do because in some countries, you can have 1,000 options. I think I was looking at South Africa, and I'm pretty sure there was over 100 options. And how do you navigate this? Not really. I mean, are you going to actually read 100 coverage plans to understand what makes sense for your company? I think at this point, this is where you need local experts. You need somebody to walk you through and kind of, take out all the noise for you. I don't have time as a client to sit there and try to understand in detail 100 plans. I need you, my local team, to really walk me through what is the compliance requirements in that country, what is standard expectation, what is a premium expectation, how do I need to think about this if I want this for my, this is my strategy, I want to hire this type of talent for my company. And I think this is where you really need to leverage your essentially your employer of record, because we have this knowledge and the depth of this knowledge, and we can really go in, we understand the market, we hire hundreds and thousands of employees. And when you see it at that scale, you really understand the trends. You really understand what progressive stance looks like. What is a standard stance look like? what is like kind of the bare minimum that you need to do for compliance purposes. And then we can really advise. We become the advisor to help you set up the right structure and the right set of benefits. And so you go from 100 to 3. That's really the goal, because if you give people too much choice, they get overwhelmed. I don't know about you, I do. Try to give me 4 or 5 options of ice cream and I'm going to stand there for 10 minutes. If you give me just 2 or 3, I'm going to be like, okay, chocolate.
Yeah.
So I think, have your provider do the pre-work for you so that it's easier. The whole goal is that you're focused on what your company needs and we're focused on what your company needs, but we do all the pre-work for you.
Absolutely. I think that's really important to highlight. You've gone through sort of why global, why local health insurance. You explain those different reasonings and why you may choose certain ones, and also why these different health benefits are tailored for each culture, the well-being, how it's going to support each individual, their family, and what's actually best for them. But also why you tailor this health insurance strategy, because there's a lot of reasons, as we've talked about, and it can be complicated. So I think it's sort of really important to go through that whole process of evaluating it from the start. What is best for me? Why do I do this? And the outcomes, and measuring that as well, I think is really important. I think we've just got a Q&A that's just come in. So I'm going to open the floor to that as well and see if we've got any more coming in. Leave the last sort of 5-10 minutes to have a few question answers, if you don't mind, Masha. So
I don't mind at all, but I don't see a Q&A. I'm glad you see it.
So how do you make sure remote employees actually understand and use their health benefits?
That's a really good one. Most remote employees actually know what they want, because if you think about it, you're not moving them to a new country. They've lived there. They understand the local sort of landscape. And often they will be the one to guide their employer to what they want. I see this all the time. It's very rare that they don't understand. The only time you have that is if you have a lot of expats, really. So the UAE is a good example. When new expats come in, they really don't know how to kind of think about it. This is where you do want your provider to sit down and kind of go through the options and explain the trade-offs. It's not always scalable depending on how big your pool is, but I think your customer success manager can sit down and really walk through, or the hiring team can really walk through the different options. But it's so rare. It's mostly employees driving their new employer to, hey, I had this coverage in my previous role, and I'd like to have at least this or better. And that's the highest kind of number of requests that I'm seeing.
Yeah, definitely. As you said, the people that are remote are the people that work there and they know exactly what they want. But I think it's important to illustrate the benefits in different ways, whether that's in your induction in like an interactive way, or making sure it's on your HR platform, making sure it's accessible, documenting all of those benefits. So there's a way to jump onto a Notion page or a Confluence and just being able to search your country.
Yeah, I mean, we do a lot of kind of standardized booklets. Again, you don't want to overwhelm the person. There could be so much, in-depth information, but what do they really care to know? And how do you just highlight the right level of signal for them to make that trade-off analysis? One of the things that I like to encourage my team is, when we create these materials, I always tell them, explain this to me, and explain it to me like I'm your grandmother. If you're using some technical language, we failed. Like, I'm not going to understand it. Explain it to me with simple, concise language. Less words is always better. I'm a big believer in that. And make it comparable across the different options, because I think often you get these brochures that are kind of full of information, and you don't really see how do you compare. There's so much in there, and so you have to do that analysis. But instead, we will do that analysis for you. We will help you compare the different plans.
Definitely. I think that's really good benefit as well. Another one here. Do better health benefits really impact retention, or is compensation still the top driver?
It depends on what level you're talking about, right? And so I think until you get to a place where your employee is not worried about their day-to-day expenses, the compensation is always going to be the driver. However, you get to a certain level where more money is nice, but it's not the most important thing because you're no longer in survival mode.
Yeah.
Then you're going to start looking at benefits. And it depends on your age group as well. So, for example, for me, the older I get, the more I care about my health benefits. I expect that, I can do a lot of things to remain healthy, and I do it. I work out every day. I eat healthy. I monitor all of my vitals. I do what I can. However, with age, it's expected I will have more trouble. And so for me, health benefits are extremely important. While for somebody in their 20s, I don't know if I went to a doctor once in like 5 or 6 years when I was in my 20s. Like it just wasn't a thing. And so you really have to think about who is it for?
Yeah. I think, yeah, it's those different factors, isn't it? What is actually for that individual, their unique needs and requirements.
Yeah. There was an interesting thing that one of my startups did where they gave you 3 options on an offer. They would give you high comp, medium comp, and low comp, and then they would pair it with high comp, low equity, for example, middle, and then a low comp, high equity. And so
Okay.
that really ultimately helped people kind of decide what was more important to them at that point in their life. It gave them choices, and it made them feel like they were driving sort of their own direction, right? And so you could do something like that with benefits. You could pair the different benefit levels with the different comp levels. There's lots of ways and lots of interesting strategies that I've seen implemented around this. And then you can measure whether what are they picking? Are they picking high comp and low benefits, or are they doing something in the middle? And that'll tell you whether compensation is the driver or not.
Yeah, I really love that. And I've never really thought of it that way, having it as that, letting them choose, because then you're able to, from the get-go, measure what they're actually picking and seeing whether
Important
it's
to
valuable.
your population. Yeah. And then how does that change over time? Because it will. In the beginning of my career, I didn't care about health insurance. I cared about comp, of course. I was a new employee. I wanted as much money as I could possibly get. But as you kind of grow, whether or not you have a family, whether or not you have, your furry children, your needs change. And so you definitely prioritize differently.
Definitely. And I think this is the perfect question just to finish up the webinar. So, how do you decide when it's time to switch from a global plan to a localized coverage plan?
Honestly, most of the time, startups tend to start with local coverage. Local coverage is more affordable and it's more tailored. And so I think that actually is for smaller startups, that makes more sense. And as they grow, what they end up doing is assessing how much assignments they're doing. For example, how many people are you sending on longer term work somewhere else? Then they would care about global coverage. They would care to be covered in multiple countries for preventative measures. A good example is, again, I have lots of examples from my past, but we had a model of forward deployed engineers where, for example, we had a regional hub in the UK, and we would send our engineers to client sites in France or in Germany or in Switzerland, and they would go and they would spend every week, they would spend 3-4 days there. If that's the case, they will need preventative coverage in both locations. Then I would consider switching, because it's a completely different ballgame and it's a different structure of how you work. But if your folks aren't traveling, if the idea is that they stay just in their local location, then there's not really a need for the preventative care in like 70 other countries. And so do you then want a more standardized but less deep sort of coverage? But yes, it'll cover multiple locations. Or do you want a more boutique sort of more in-depth coverage for that higher end location?
Definitely, and I think that sums it up perfectly. I'm just going to put like a little call to action at the bottom, just so you guys can actually have a little look at what we have and what actually will be best for you. Our global healthcare plans. We obviously just opened up our Remote Health Local, which is, as Masha just spoke about, that if you are looking for something that's more tailored and beneficial for those who are staying in that country. And yeah, it's the perfect option. So yeah, check it out. I'll leave that there. There'll also be a link in the email afterwards, so you can have a little look at that. I'll move that for now. But yeah, thank you so much for everyone joining us today. It's been a really great insight from Masha talking us through the who, what, where, why of global and local health insurance. So,
and definitely reach out to us. Reach out to us if you have further questions. Reach out to us if you have suggestions, if you have feedback. It's always interesting to have these conversations. And to me in particular, I'm always interested to tailor the approach to the company needs. And so I find that I learn the most when I have those interactions. So feel free to reach out.
Absolutely. Thank you so much, everyone. Hopefully see you on our next webinar. Bye.
Bye-bye.